Okay, the next test we'll do to assess possible ACL tear or laxity is called the Lachman test. Lachman test tends to be more valid and reliable than the anterior draw test, but in some cases it's a little more difficult to do the test, especially if the patient has larger thighs and you have smaller hands, which is not the case here. With this, you want to make sure the patient's relaxed, as always. Make sure she's not guarding, there's no swelling or pain in the knee while you're doing this. You want to lift up the knee, stabilize the femur, posterior and anterior. So you're blocking it anterior, and then you also want to take the posterior medial aspect of the tibia, slight external rotation of the tibia, and then you'll block with the right hand in this case, and then mobilize with the left hand. It should be a quick movement. The patient should feel a clunking sensation, and that's the ACL engaging, stopping, so it's a firm, abrupt end feel. So you're checking for that. If you do get that abrupt end feel, you know the ACL is intact. If you don't, and it's a squishy end feel, it's either swelling or the ACL might be totally torn in some cases. You're checking for how much excursion, how much movement of the tibia on the femur, to again grade if it's a grade 1, 2, or 3 ACL sprain. Again, we stabilize with the right hand, and then a quick movement to check the motion of the tibia on the femur. I'll show on the other leg so you can get a better visualization of the mobilizing hand on the tibia. Stabilize the thigh and the medial posterior aspect of the tibia, slight external rotation, and then again it's a quick movement and checking for how much movement. Interesting case here. This patient did have ACL reconstruction on the right knee, and doing the Lachman test I actually feel slight laxity on the left, and the reconstructed knee, which was done approximately 6 years ago, is even tighter, which is a very nice result after the surgery. Okay, and you would always check bilaterally. I would do an anterior draw test in addition to the Lachman test if possible.